This is an instructional video for how to screen a discharge TTO using PowerChart. Once you have opened up PowerChart, navigate to the Pharmacy Care Organiser and the top bar. This is sometimes shortened down to PCO for its initials as well. Once you have selected it, this screen will open up and your patient list can be selected from this drop-down arrow. If you need to add any new patient lists, you can use the List Maintenance button and select New and follow the steps to add a new ward area or area of the hospital. Once you have the correct patient list, locate the patient for which you would like to complete the TTO for and scroll along the columns to find the tasks, which is found here. Once you have selected the task cell for the patient, this will open up the full list of tasks that are outstanding. The TTO lock will open up and you can select Document. Here you are able to lock the TTO, which will prevent any clinicians from making amendments while you are screening the TTO. You can then sign this form up using the green tick at the top left corner. Click on the patient's name that you have selected and you can use your pharmacist view using the left-hand menu column and navigate to TTO meds. This will then pull up your discharge medications tab, which you can also navigate to using this button here, and select on the discharge tab here, and this will open up the patient's TTO. On the left-hand side, you have your orders prior to reconciliation. The scroll icon denotes that this is a medication that patient was taking when they were at home. The hospital icon denotes that this is a medication that has been prescribed whilst the patient is on the ward. And the pillbox icon denotes that the medication has been prescribed for the patient to go home with. You will see on the orders after reconciliation, these icons with the pillbox and the pestle and mortar have appeared. This shows that a supply review is needed, and the pestle and mortar also shows that a pharmacy review or a pharmacist review is needed. You can click on this and this will pull up a box at the bottom allowing you to review the medication. If you're happy with this clinically, you can sign this box and you will see the pestle and mortar disappears. If you require supply of the medication or if you have made a supply assessment, you can select the correct supply option from this box here. So, for example, if there's any medication endorsements that have been completed at the point of doing a medication history, you can hover over the scroll items and you can see that any endorsements such as pods at home will be available to view just by hovering over the order. You can continue to go down and complete each of the steps for each patient. That is required. If for any reason you would like to change something in a prescription, you can right-click, select the Reset button, and then you can right-click and you can choose Modify without resending. This will open up the prescription for you to make any amendments that you might want to. So, for example, if you wanted to change the day supply to only, you can do so here. You can use a special instructions box to document anything that you would like the GP surgery to see on the finalised version of the copy. So, for example, if there are any comments that you would like for the pharmacy team to see but not to appear on the final copy, you can add this under Order Comments. You can then use the Prescription Review and Supply tab here to add what comments you would like, along with the pharmacy review, the supply options, and how much supply you would like from pharmacy. You can continue to go through the prescription for the TTO and complete each section as appropriate. For controlled drug prescriptions, you can review it here in order to see how much the prescriber has specified to be supplied. If you hover over the order, you can see that the total quantity has been completed by the prescriber. If anything needs amending within line of legal guidance, you can again reset the prescription, right click, and you can amend in this section here. For example, if one of the words or figures is missing, you can add this in this section. And you can again include your PC, PNC comments in the special instructions for it to be available for the GP to see. Or if you would not like it to appear on the final copy, you can include this in the order comments. The TTO will not allow you to proceed to the next step until all of the parameters have been completed. And by this, I mean ensuring that all the mortar and pestles and the pillbox icons have been completed. Once you've completed all the parameters around the pharmacy review and the supply boxes, you can select Sign and Print in the bottom right corner. This will pull up your managed print system, and you'll be able to select the correct printer by selecting the drop-down button and selecting OK. And then this will automatically print. Once you've finished screening the prescription, navigate to Multi-Patient Task List and find the Reception tab for your ward. Once you've finished screening your prescription, navigate to the Multi-Patient Task List at the top of the screen, and this will pull up your task list outstanding for your clinical areas. Navigate to the Screening tab, and this will pull up the task for pharmacy discharge medication review. Ensure that you have your correct ward or area assigned under here. If this needs to be changed, you can right-click and select Customize Patient View and select the correct list that you would like to view. And ensure that you have the correct time frame allocated as well. This again can be modified by right-clicking and selecting Change Time Frame criteria. Once you have selected this task, you can double-click it, and this will pull up information around the discharge medication review. You can also at this point see the medicines reconciliation task that was completed at the patient's point of admission, and this will contain any additional details such as whether they're using a blister pack, if there's any other information, and who's completed it. Once you have reviewed any information that is included within the medicines reconciliation task, you can switch back to the discharge medication review. You can select whether there was a problem with the screening and if you're happy with completing the screening. If medications require dispensing in pharmacy, select yes. And if there are any comments that are needed for pharmacy, you can also add these in. Once you're happy with this form, you can click on the green tick in the top left corner, and this will move the task out of this screen once you click refresh. You can then sign into the In Progress tab and open up the task again to then unlock the TTO. At this point in time, the discharge medications will unlikely be ready for collection or delivery. However, the ward teams can use prescription tracking system or PTS to review the status of a prescription. Once this is done, you can click on the green tick box in the top left corner, and this allows the TTO to be left unlocked should a prescriber need to add or make any amendments to the TTO. In order to print off a controlled drugs prescription for the patient, navigate back into the patient and select on Pharmacist View. Navigate to TTO Meds at the top, and you'll see here that there is a controlled drug prescription. Select on this. It may ask for an override discharge requirement, and you can complete this form. Click on Submit, and this will pull up a discharge prescription for you to view. You can click Sign Submit and sign in the bottom right corner. Navigate to Documentation on the left-hand side underneath the Menu tab, and here you'll find the controlled drug prescription. From here, you can right-click on the document and select Print, and select Medical Record Request. Select OK. And within the template, select Document Report, and within the purpose, select for paper medical record. Select Preview. And here it will ask whether you're ready to preview the prescription, and you'll be able to select Yes. From here, you'll be able to then print the TTO for signing by clicking the Print button and selecting the appropriate printer from here. Ensure that a copy of the printout is signed and sent to the pharmacy department for release of the prescriptions. If you have any further questions about this workflow, you can look at the quick reference guides, which also has further information about which printers to select, or get in touch with one of the EPR team.